Good afternoon, everyone. We're going to get started. I'd like to introduce John Collins, who is the Director of the Office of Medical Marijuana at the Department of Health.
Thank you, and good afternoon. Pretty exciting day today, and thank you for joining me for this press briefing. Today I will be sharing with you the progress we've made since our last press briefing in April, and highlight the additional items we're diligently working on to implement Pennsylvania's medical marijuana program. I'd like to start by sharing an update with you on the safe harbor provision, the first step taken by the department to implement the medical marijuana program. I'm pleased to report that to date, the department has approved 271 applications. This means that 271 parents, legal guardians, caregivers, or spouses of minors who have been certified as having serious medical conditions now have a safe harbor letter that allows them to possess medical marijuana in an approved form to administer to their minor in the Commonwealth. The role of physicians in making sure that patients can access medical marijuana cannot be underestimated. That's why publishing the draft temporary regulations for physician preparation or participation in the program in the Pennsylvania Bulletin on June 3rd was so critical. During the month of July, we will have our physician registry in place so they can begin the process to participate in the program. Our biggest undertaking to date has been the application review process for growers, processors, and dispensaries. We received a total of 457 applications, 177 grower-processor applications, and 280 dispensary applications. Today, we are issuing 12 permits for grower-processors, 2 in each of our medical marijuana regions, as illustrated in one of these posters. You should know that every entity that applied for a grower-processor permit is being notified by mail today regarding the following: the granting or denial of their application, their individual scores, and instructions on how to file an appeal with the department if they so choose. The letter is addressed to the contact person named in the application and provides instructions regarding the appeal process. I'd like to now go into greater detail about the process that was used to review the grower-processor applications. The Office of Medical Marijuana received more than 500 packages. As we discussed with you in April, we had a very thorough and careful process to log in each application. At least 2 staff members witnessed each package being opened. Some of those packages contained 1 application, and some contained multiple. While the process was occurring, the applications were reviewed for completeness, and then our evaluation team met to review all timely submitted and completed applications. The evaluation team was comprised of Commonwealth agency experts in their fields. Our regulations maintain the anonymity of team members to avoid any interference with their work or influence from outside parties. I want to take this opportunity to thank them for their hard work and dedication. We could not have reached this point in the process without their valuable skills and their commitment to the program. Each permit application was evaluated using the scoring rubric that was included in the application instructions. And to my left is a sample of the scorecard that was utilized. Please be aware that later today you will be able to access all of these scorecards for all of the evaluated grower and processor applications on our website, which you know is health.pa.gov. All of the redacted grower processor applications will also be available on our website by the end of July. It's important to note that this has been an objective process. Please also be aware that today signals the start of the next phase of the medical marijuana program. The 12 permittees will have 6 months in which to become operational. Growers, processors may not begin to grow medical marijuana until the department has deemed that they are operational. Also be advised that by the end of this month, we will also issue the permits for the dispensaries. Our physician registry will also be online in July, and we plan to publish regulations in September for patients and caregivers to participate in the program. During September, we will complete the patient registry, and in November, the seed-to-sale electronic tracking system will be fully operational for growers, processors, and dispensaries. Issuing permits today for growers and processors is a significant step forward in the implementation of Pennsylvania's medical marijuana program. We remain on track to get medication to patients with serious medical conditions in 2018.